Hi everyone, Dr. Muse here. Welcome to volume 2 of the topic depression and how to cope with depression and how to go about, beating it. All right? You shouldn't let it control you. In the previous video, I talked about how to spot and identify the likely symptoms and signs of depression, you know, and how it can be a very confusing experience for the person that is going through it. And how it shouldn't be perceived as a stigma because it isn't a stigma. Because if you perceive it as a stigma, because the society, some parts of society has made it look like that, and that inhibits you and that makes you want to keep it within because you are afraid to speak out. And that is such a burden. It is such a mental burden to keep within because then you find yourself going out in public and you're wearing a mask, all right? A mask, an invisible mask that gives the impression that you're happy, but there is a lot going on inside, and you're just crying out, crying for help, but no one can hear you because you are wearing this mask that says I am fine, but you are not. You are dying inside, and you're screaming for help, but you are afraid to speak out because you don't want to be labeled as someone with a mental illness. But I'm here to say that there's a lot of avenue. There are a lot of avenue out there, full of healthcare professionals and mental health professionals who are there, and they are ready to help. It can be through the phone, calling certain hotlines. If you're feeling these symptoms, the symptoms I mentioned earlier, the low mood and sadness, the the poor sleep, the loss of interest in things that you usually enjoy, the crippling feeling of guilt, if you're feeling tired and exhausted and having low energy all the time, if you notice that your concentration is really poor these days, or if you feel always anxious and agitated all the time, and if you notice that you consume with a negative perception of life and always finding yourself being pessimistic, you know, feeling worthless, and and if you're finding yourself having ideas of suicide ideation, you really should, get on the phone, go on the internet, search for mental health service, get on the phone within the confine of your home. You can call, you can make an appointment because there is help available. Now, what are the help available? For one, you can always meet your family physician. You don't feel like a burden to them because it is their job and they are happy to help. They are happy to help. Speak to them. If you want to keep some privacy and confidentiality and you don't trust talking to friends, meet your family physician, speak to him. If it's not a family physician, walk into any clinic, walk into any health service, just say, or call the hotline and say, I need to speak to someone. This is how I'm feeling. I don't know what is going on. And they can refer you to the appropriate people, who deal with this, who can help you get through it. And they are happy to help. And it works. It's not a short-term process, but it's a continuum of efforts and participation and involvement from your end and from the end of healthcare professionals, and also the involvement of your trusted friends and caring, loving family. It's a collaborative effort that can work together to improve your mental well-being. And it's a phase that would pass. It Having depression is not the end of everything. You can live with it and cope with it and beat it. You just have to keep an open mind. First, you have to believe that there is help out there. You have to overcome the shame, the the feeling of being a burden to others. Forget all that. Just pick the phone and just call and ask for help. Things that can be suggested when you meet a healthcare provider is that they can send you, to a therapist, a psychotherapist for psychotherapy, And basically, what is normally done in psychotherapy is a series of what we call talk therapy, talk sessions, where the therapist can try to initiate what is called cognitive behavioral therapy, or CBT for short. That is just a fancy word to say that the therapist will try to get you involved, right, in changing your perception. Remember, cognitive behavioral therapy is a therapy that involves changing your cognitive way, the way you think about yourself, the way you think about life, the way you think about the world itself. It helps you alter those negative feelings, those negative thoughts process that you've had in your mind, which have manifested in your interaction with the society in a negative way. Because during depression, we are consumed with negative thoughts, and that manifests in our life and our interaction in a negative way, which leads to more social isolation, compounding your already, negative mental state. So, cognitive behavioral therapy would involve behavioral modifications, all right, alteration of thought process and your perception of self concept, of your self esteem, and of life itself. It also teaches you to be very assertive, to have the confidence to express yourself and to speak out without feeling of shame. It has a way of instilling that confidence and self-esteem that has been lost when one is plagued with depression. And there's evidence to show that it's a long process, but it is to a certain extent efficient. Now, if talk therapy and CBT doesn't seem to be working, the next step would be to go on antidepressant medication. And again, there is evidence to suggest that some of these medications do work. It is not an instant relief. It's important to know that the antidepressant medications, all right, they usually take 2 to 4 weeks before you start noticing their effect. So when someone is placed on this antidepressant medication, all right, your physician might tell you that you're not going to get a sudden relief. All right, you start feeling the relief or the therapeutic effect or the effectiveness of the medication 2 weeks from the date you took it, 2 to 4 weeks from then. It's also important to remember that when you're on these medications, all right, in the very first 4 weeks of being this medication, sometimes you might find out that there's a sudden rapid change in your mood and you feel kind of better. But sometimes there's also a risk of having suicidal ideas during that early stage before the medicine kick in. But it's just something to be aware of. And if you feel that way, that you're having persistent suicidal thoughts while on the medication in the early phase, pick up the phone. Please just pick up the phone and ask for help through one of these mental health helplines. Alright, if you don't know what they are, you can always go in your area. There are many hotlines, and someone can speak to you and talk to you. So that's it doesn't happen all the time, but that's something to also be wary about. But these medications take 2 to 4 weeks to kick in. Now, sometimes you may be wondering, how do these medicine work? This antidepressant medication, how do they even work? Basically, it's important to know that there is an hormone, all right, that travels in our in our neurons. This hormone is known as serotonin. Now, there's evidence to suggest that if the amount of serotonin level in our body is below normal, meaning it decreases, then there is a correlation, an association, a relationship between low serotonin level and feeling depressed. So in most patients who have presented with symptoms of depression, when the test is done to check their serotonin level, it has been found in these patients that their serotonin level is low. So what is being done is that antidepressant medication is given, all right, to help reverse this effect, to help increase the serotonin level back to normal. All right, so Many, and sometimes not just that, there are other hormones that are also implicated in depression that might be low. Things like noradrenaline, or known as norepinephrine. So I don't want to go into the pharmacology here because this is just a message. I'm trying to keep things very lame, very simple here. I'm sorry, very simple. So basically, this antidepressant medicine help to help to initiate a change in the hormones in our body, in the neurotransmitters in our body. It helps to bring these hormones from a low level back to the usual normal level. It helps to increase the serotonin level. It helps to increase the noradrenaline level. It helps to increase these hormones in the brain, in the body, these neurohormones. It brings them back to normal level. So we find out that when the hormones are back to normal level, our symptoms, most of the negative symptoms disappear and we feel better. There's an improvement in our mental state, and that will manifest in a positive way in the way we interact with society. So that's how antidepressants work. Now, in some very rare cases, there are cases where the antidepressant might not work, all right? So we call those resistant depression, refractory cases. In that case, it's not very common, but sometimes what we call electroconvulsion therapy, ECT, all right, can also be used. But I don't want to really go into that. For the most part, and thankfully, CBT, cognitive behavioral therapy, talk therapy, has shown to be very efficient in helping to improve and integrate someone who is depressed back into their usual happy state or effective functioning state, and can help them get their life back together. And sometimes a combination of CBT, having to go for sessions of this talk therapy, plus being on this antidepressant medication, a combination of those two tend to help. All right. Now, if you are someone who don't really want to have to go to the hospital to see a doctor, and you feel I don't want to have that on my medical record, okay, and now you don't want to call and talk to anybody, if you have trusted friends, if you have loved ones in your family that you trust, it's important to speak out. You really have to speak out because it's so much burden to carry inside. Speak out. There's always a feeling that you might feel that, oh, I don't want to be a burden to them. It's always one of the most common reasons why people don't speak out. I don't want to be a burden to my friend. He or she has enough problem of theirs. I don't want to be a burden to my parents. But that's not how they see it. How do you feel? It's They are your friend. For better and for worse, they are your friend. That is true friendship. You share the good times together. You share your pain together. It's these experiences that makes life worth it. Okay? Speak out to people that you feel truly loves you and that you can trust. Alright? Not people that would avoid you or make you feel stigmatize you. Those that you can trust. And if you don't have anyone you trust, there's helplines. Call those mental health service helpline and get the help that you need so you can get your life together. Suicide is not the answer, because some people will see suicide as a selfish decision because you didn't give people who loved you the chance to know what's going on in your life. And there are some people that even look up to you as their own source of inspiration, believe it or not. They look up to you. Some people want to be like you. For everyone that you think don't like you out there in the world, there's someone else who loves you. Alright? Some people don't express it out, but they love you from a distance. Some people are probably shy to let you know that they see you as their role model. But then you're just right there thinking that you're a burden to everyone and you don't deserve to be part of the present reality of life. So these are my own suggestions based on my experience, my work experience in the past with patients that have been going through, that have had depression, as well as from some of my studies in this case. Please speak out. Depression is not a stigma. It doesn't have to define your way of life. It doesn't have to define your reality. Alright? Just picking up this phone and talking to someone initiate a chain of events that can lead to an improvement and betterment of your life and the life of those around you. There is always help available and there's always someone that loves you. I hope this has been helpful. Please like and subscribe. Thank you.